Hi, I'm Rob Liebman, and I lead our go-to-market efforts for MLR services and technology at Indegene. And joining me today on this episode of MLR in the Agentic Era is Sameer Lal. Sameer is on the executive leadership team of Indegene and has global responsibility for its enterprise medical business unit. Sameer has been an innovator and thought leader in medical affairs for 3 decades, having helped and guided countless CXOs with their business transformation efforts that leverage new technologies. And while I have the good fortune of speaking with Sameer often, because for transparency's sake, I'm part of Sameer's leadership team, I'm really looking forward to taking a step back from the daily grind and taking this opportunity to chat with Sameer and pick his brain to get some practical and valuable insight. So welcome, Sameer, and thanks for joining me today.
Thanks for having me, Rob. It's a pleasure, and I'm very excited to talk a little bit about our emerging technology and what we are seeing in the landscape. Very happy to be here.
Great, thank you. So, for somebody obviously in your role, we're not going to necessarily go down any narrow tunnels and stuff because it's really important to understand macro level trends and topics, right? That when you speak to executives that you're faced with or that come up in discussion. So from an enterprise vantage point, what macro trends are you seeing across R&D and commercial functions? And I'm thinking specifically about technology adoption, talent, and governance, those types of things. So if you could share a little bit about what you're seeing, it would be really helpful for our audience.
Of course, Rob. First of all, I think it's never been a more exciting time to be in the pharma space. Last year was all about pricing pressures and tariffs and MFN and so on. But we are seeing that pharma leaders, both R&D and commercial side, are really being tasked to deliver unprecedented patient impact, right? How do we have faster, safer, more efficient products, all within the guidelines of regulators, also providing the clinical evidence and so on. The expectation is how do we accelerate R&D productivity? But very, very importantly is how do we actually get peak revenues faster, right? So how do we get launches which are truly successful? The other interesting dynamic around technology has been that the stage of pilots have been crossed. I used to wonder last year if we will ever get out of pilot purgatory, and I believe that seems to be coming to an end because now it's all about scale, right? So it's not just about, hey, can we prove a use case, but can this be done at scale? And I think that's what pharma leaders are looking at very, very keenly, and I feel that we've come to a light at the end of the tunnel stage now.
It's great. Yeah. It's pretty interesting because, obviously there are folks that opinionated on both sides. But when you mention, the patient centricity and obviously a focus on patients, they're not mutually exclusive, right? So pharma companies are obviously in the business of making money. And you mentioned, revenue and revenue optimization, but their goal is to help patients. I just did want to point that out, picking up on what you were saying, relative to serving the needs of patients, obviously, and from that they benefit as well. Mm-hmm. When you look at large pharma portfolios, what are the highest value friction points in content development? So again, we're looking at could be content development for HCPs, or here obviously in the States it could be ad promo directly for patients. But what do you see as the major friction points?
Absolutely. Like I mentioned, right, there's a huge focus on making launches being successful and getting to peak revenues as fast as possible. Now, pharma is pivoting a lot into rare diseases, orphan indications, oncology, and all of that. Therefore, articulation of the key messages and making sure it reaches the right audience, which is, by the way, not just HCPs, but advocacy groups, payers, becomes hypercritical. And one of the key learning here is volume is not equivalent to effectiveness. Hyper-personalization is actually becoming a huge buzzword, right? And hyper-personalization, which can come through, say, omni-channel. By the way, I don't think anybody has really delivered omni-channel at scale, right? Modular content, all of that is coming to bear. Now, in all of these scenarios, actually the holy grail is, can you get content on demand right there then? And this is where the requirement of a technology solve for MLR becomes so important, right? Because at the end of the day, in spite of all the progress that we have made on content, on technology and so on, we haven't solved for a huge pain point, which is MLR, right? It always remains a choke point for better reason because we are in a regulated environment. But I feel now with the advent of technology and more importantly with the agentic approach and what next MLR can offer, I feel that there's a solution which is now available for truly getting hyper-personalization at scale and possibly on demand as well.
Yeah, it's pretty interesting. We could probably have a whole separate discussion on omni-channel versus multi-channel because as you mentioned, just developing more content is not necessarily omni-channel. And I think, what you're talking about, personalization, really refers to knowing your audience, right? Knowing the HCPs to personalize that content. But under either scenario, what we've seen, as you mentioned, is an explosion in the volume of content, and therefore the need for effective and efficient, right, MLR approaches and methodologies and tools is even more front and center. So it's these are very good points that you're bringing up. If I was to build on that, and we looked at MLR solutions, and solutions could be a combination of technology and people, but obviously we know it's going to be largely driven by technology as time goes on. How does some MLR solutions fit into the broader ecosystem? And I'm thinking about, when I say ecosystem, people, process, platforms, and what does enterprise readiness really look like? Because even earlier on, right, you mentioned that at scale, right? So considering, how it fits into the broader ecosystem, and what does enterprise readiness really look like?
Absolutely. So first of all, from my vantage point, I feel generative AI is actually as much of importance as internet was or move to cloud computing, years ago. I think the inflection point is as tremendous, and with Agentic AI, the latest iteration, we've truly reached a stage, where we can actually get a lot of that vision into reality. Now, in order for technology to work, we have to rethink our ways of working. So it's not about, with the Agentic AI approach, I swap out Rob and I put an agent in, Actually, we have to rethink the entire process from ground up. The ways of working have to change. But at the end of the day, what we have to do is provide a seamless experience to the end user. So if they're used to working on a specific workflow, the technology should be behind the scenes. So for the experience for the end user should be seamless. I think that's what Next MLR is able to provide, right? It ties in directly into workflows, whether it's Viva or whatever, right? And so for the end user, it's all behind the scenes, and they are able to derive the maximum amount of value from technology. And that's what technology does best, behind the scenes, silently working.
Yeah, that is great. And so I was speaking with some other folks yesterday, and picking up a little bit on the change piece, right? That if you have you could have the best solution too, but if you're not thinking about it, as you mentioned, in the broader ecosystem and operating behind the scenes and how it really suits individual organizations, folks will probably miss the boat. So that is obviously really interesting. It leads into, again, when we pick back up maybe either on the word enterprise, right? So when you think about doing this where the solutions, where the technology could sit behind the scenes, it's really transformational. Which controls matter most when we are thinking about at scale? And that's like model governance, the auditability, role-based access, human in the loop. How do we ensure they're practical? So like what matters most at scale, and how do we do it from a practical standpoint?
It's interesting you asked me that, Rob, and I was reflecting, as humans, our expectation of technology is completely different from the expectation of humans, right? Think about the headlines which come when a self-driving car causes an accident, right? And it's headline news. Do we know how many people died on the road by accidents? There are literally 1,000 people, and it's not news at all anymore, right? So the bottom line is the expectation that we have of technology is radically different than what a human could do. And therefore, the key factor, and I believe, is none of the items that you mentioned is actually managing change. Because at the end of the day, technology can do whatever, but people will have to change. Now, last few years when Gen AI came in, everybody's worried about jobs and so on. But I think we've traversed that. We realize what the value technology can do, right? And at least the mundane, repetitive tasks can be done better with technology. And I think now the human expectation has to evolve as well. But the end of the day is about managing change, making sure we have people being comfortable with the use of technology and getting the most value out of it, right? So we should never undermine how difficult it is for humans to change their ways of working. And I think that's where most of the work has to happen. actually.
Yeah, it's so important. I mean, I couldn't agree more. And when you think about change management, it's often an afterthought. And picking up on one of the very first things you said during this conversation about in pilot purgatory, a lot of that isn't necessarily even the solution specific, but it's the fact that they're not focused on change. So humans keep doing these pilots because they're hesitant to actually change and even maybe look at scale. So I think, yeah, you're spot on, and we should never underestimate the need for effective change management. So I think we're going to run out of time, right? But it's always a pleasure. And before we do conclude, Sameer, if you could, if we can get your view as we look at everything we discussed, right? If we could think about what would good look like in 6 to 12 months. So we mentioned pilots, we mentioned the need for change, we mentioned the explosion in content. So again, in 6 to 12 months, what would good look like? Because we know we can't get to perfect. So maybe you could just share some thoughts on that before we close out.
Yeah, absolutely, Rob. I think first piece is that after last 1 year, the hype cycle has subsided. Some of our competition, etc., had made unrealistic expectations created out of technology. I think that has started to settle down. I think next 6 to 12 months, I feel the opportunity is for MLR and therefore next MLR to be completely embedded, right? And perhaps truly coming to bear for our clients, showing the kind of KPIs that technology actually promised. And I really feel from my vantage point, from the implementation that we've already started with 2 large pharma, that I think we will definitely see that by the end of the year. And I'm pretty certain we can see that happen across the board, across pharma, big size, medium size, small size. I think that will be our wish. I think we've crossed the hump, so to speak, and it'll be all about now truly delivering value as far as the MLR processes is concerned.
That's great. I really hope even outside of this podcast that we could find some more time to have this back and forth, because not only do I find it enjoyable, but the insights that you share are always spot on and really give us food for thought. So I just wanted to thank you again, Sameer, for spending this time and lending us your expertise and insights. It's always great.
Thank you so much for having me again, Rob. All the very best.
Thank you.